Hi, my name's Dr. Shetal Shah, and I'm a neonatologist and pediatrician interested in child health insurance coverage and access and in issues of immunization. I'm pleased to present my Gene Copello Health Advocacy Fellowship, which was graciously provided to me through the amazing organization Doctors for America. I think the most important part of the Advocacy Fellowship and the Health Policy Fellowship is that you really begin to find your advocacy voice. And as a pediatrician and neonatologist, this is extremely important to me because children really are more than any other segments of our society, really and truly vulnerable to social determinants of health. Children are the poorest segment of our society. So, one of the things I learned during the fellowship, and one of the things I appreciated, was the ability to educate other people who are in positions of power and who are in positions of policymaking authority about these issues and how they influence child health. And one of the ways that I really learned to do this and really fell in love with this was during our session on writing opinion and editorials. So I was able to work on several op-eds on what children need in this next upcoming election, what pediatricians are hoping for in 2023 to talk about immunizations and immunization access, and to talk about potential legislative changes to the social media landscape which could benefit children. As we go through the public health unwinding in which millions of children are being disenrolled from Medicaid, really in all 50 states, I thought it was important to explain to people what that was and what the health implications are, specifically because so many children, almost 50% of children, are actually covered by Medicaid nationally. So as Medicaid goes, really so does the health access for our children and ultimately their actual health outcomes. I also thought it was important to lend a voice and to educate the public as to what happens when our immunization rates decline. If you're a pediatrician, immunization and public health are really in your DNA. You see yourself as someone who's there to take care of sick children, but who plays a major role in keeping children healthy. And when vaccine confidence declines, we really do damage to our public health infrastructure. And I think that's another valuable tool that the fellowship really offered, the ability to understand that you really have to have the ability to communicate the rationale for evidence-based policies to policymakers, to decision makers, to non-physicians. That's really an essential skill for pediatricians and really for all doctors in the 21st century. I also collaborated with one of my colleagues in Utah to talk about the importance of extending postpartum Medicaid coverage to 1 full year, both as a means for improving the health of women who have a lot of chronic conditions uncovered during their normal prenatal care, but also as a means of potentially reducing our embarrassingly high rates of maternal mortality. As someone who's interested in Medicaid coverage, the DFA fellowship really gave me the opportunity to reach out to stakeholders. Here I'm working with a colleague of mine, Emily Miller, to provide Medicaid coverage in certain states for pasteurized human donor milk. And we were able to present to the entire Association of State Medicaid Directors and explain to them that certain states have done this and these are the health outcomes that they've achieved and the cost effectiveness of this measure. And as a result of just this presentation, we're still working with several other states who are considering implementing this policy and providing this coverage, which for a neonatologist could reduce the incidence of a potentially lethal disease called necrotizing enterocolitis by almost 50%. And finally, I've had the opportunity to meet directly with the staff and the legislators in Washington, D.C. Through the fellowship, I've gained experience going to the halls of power, meeting with legislative staff, and talking about a whole host of issues that are important to child health, whether it be the Kids Online Safety Act, which can enact common sense protections for children on social media, whether it's talking about the importance of maintaining a strong supplemental nutrition assistance program or SNAP program so that we don't have children who are hungry, or whether it's about issues related to gun violence prevention or funding our public health departments so they can maintain our public health infrastructure and keep our vaccination rates high. The fellowship has really provided me the opportunity to learn how to do this, to learn how to do this effectively, and I'm really hoping to make this an even bigger part of my career moving forward. So I wanted to thank Doctors for America, thank my pediatric colleagues in the American Academy of Pediatrics, and thank you for listening.